Hello, I'm Jeannie Summerlin with the Alabama Department of Public Health Comprehensive Cancer Control Coalition. I'm joined by Dr. Karen Meneses, Associate Dean for Research in the School of Nursing and co-leader Cancer Control at the UAB Comprehensive Cancer Center. Today we're going to be discussing how important it is for cancer patients and survivors to communicate their needs with their healthcare team. Good morning, Dr. Meneses.
Good morning.
Now, we hear more and more about the importance of cancer survivors taking an active role in their health. What exactly does this mean, and why is it important?
Taking an active role in one's health means taking part. And so it seems very simple to think about it, but oftentimes we have patients who are very content to sit and listen to their physician. Why is taking part and being active in one's health care important? Because it usually leads to better outcomes. In other words, someone will know more about their treatment, they may know more about their side effects, and they'll be able to monitor them as well. The next key ingredient, though, of taking part is really good communication and having those lines of communication open, and to be as, it's very important for a survivor or a patient to really share her dreams or aspirations or his goals in life in order to make that work better for treatment that they're going to be undergoing.
Who is part of the healthcare team, and what is important for them to know?
Healthcare team, it can consist of many individuals. That team may be a doctor, physician, maybe primary care physician, maybe the nurse, social worker, nutritionist, pharmacist. All of these are members of the team that need to work as best as they possibly can in order to have good and better outcomes for patients. And why is that important, again, to have communication is because the more people that you have in your partnership, the more communication is necessary in order to make sure that the outcomes that one wants to achieve are achievable.
What are some ways that cancer patients and survivors can foster open relationships with their healthcare team?
Well, the first is to find a doctor that really fits your needs, and a doctor who is also one who you can communicate with. I think that comfort is really, really important because, again, this is a relationship, it's a partnership, and it is also based on trust as well as communication. So that's really the first part as well. The second is that you have to think about the medical decisions that need to be made, and those medical decisions are going to influence the rest of their life. So what can also be done? One is to bring a family friend, a trusted friend, who could be your second set of ears in terms of listening and listening attentively and attending for you. Third item is if you are undergoing treatment for other kinds of conditions, it's really important to bring your medications, or just put them in a bag and just bring your medications to your doctor so that they can better know the other conditions that you're being treated for. Have your friend take notes at the time of the encounter so that you can go back and examine and understand better what was said during that time. And then the last area is that of letting your team know what are your short and your long-term goals, because treatment can last over several months, and there may be many other things that can occur during that time, and it's helpful for them to get to know you as well.
Well, that is all such wonderful advice. What are some other tips that you could recommend for cancer survivors and patients?
Knowing one's side effects during active treatment is really paramount, because then we'll know what one should expect and what one should not expect after or during treatment. The second piece is that really knowing who to call and when in any case of an emergency or urgency. So having those phone numbers ready at hand and the numbers of your healthcare team. Sometimes the pharmacist is really important to know in the middle of the night in case you may need some medications as well. Make a list of all the things that you care about, particularly after treatment ends. So survivorship care planning is paramount. There are many things you have to attend to during treatment, but after treatment ends, in the survivorship period, there are other aspects in terms of your day-to-day activities, who to communicate with, and what kinds of side effects to expect are also really important to know. The other is to ask for help for understanding and better learning about healthy lifestyle behaviors after treatment has ended. If survivors take advantage of the American Cancer Society guidelines for physical activity and the American Cancer Society guidelines for nutrition, they've got the majority of the tips and strategies already at their fingertips in order to lead a better healthy lifestyle after treatment has ended.
Now, are there any technologies that can help patients and survivors find resources that can help them out with their progress?
Absolutely. Today there are voluminous numbers of resources that are on the web, and the key is really to know what are the evidence-based resources that are really reputable. One I would recommend would be the Pocket Care Guide from the National Coalition of Cancer Survivors. It is available for download, and you can also go directly to their website. They have a voluminous amount of information about communication, about your healthcare team, about survivorship care plans, about advocacy, and about a lot of other resources. And they present it in a way where it's not overwhelming, because remember, we want things to be communicated very clearly and very simply, and there's also more information in case they need to know that. And the second recommendation I have is to go to the UAB resource app. Now, this was recently developed by a faculty in the School of Nursing at UAB, and it focuses on counties, 5 specific counties. But what they did was they looked at, in each of those counties, what were the most important resources that are important to patients? Where do I go for that wig? Who can help me in terms of Meals on Wheels? What are the other resources? So it was really very practical, and I think that would be a very, very terrific resource also as a model that can be used and developed for future use in the rest of Alabama.
Definitely, that's wonderful. What would you say are the take-home points for the viewers who are watching?
First take-home point is take an active part and be a part. The second take-home message is communicate, and learn to communicate even the difficult things that someone doesn't want to talk about. Oftentimes a survivor or patient will say, I don't want to bother my doctor. And yet that might not be the best decision, and so keeping that line of communication is open. And third, there are resources, a lot of resources, but focus on the ones that are most reputable. Those would be my recommendations.
Wonderful. Well, thank you, Dr. Meneses. That was all such great information. And thank you for joining us with our segment on communication with your healthcare team.